All right. Hello, my name is Mary Sue Gardner. Thank you for joining us today for using the KX modifier on dental claims that are inextricably linked to covered medical services. Again, my name is Mary Sue Gardner. I'm a registered nurse on the Provider Outreach and Education Department here at WPS. And I'm joined today by my co-host, Aline Sigler. So we're going to kind of go back and forth, Aline and I, in this educational event. I'm going to talk about coverage criteria and the services that are reasonable and necessary in accordance with Medicare guidelines and what kinds of documentation you have to keep if you want Medicare to pay for some of these dental services that are inextricably linked. And Aline is then going to talk about how to append the KX modifier, when it's necessary, and that kind of thing. So next slide, this is our disclaimer slide. We show our disclaimer at the beginning of every presentation. And this disclaimer basically says this education was prepared as a tool to assist you in our provider community. But as you know, Medicare laws, rules, and regulations often change. So it's your responsibility as a provider to make sure you are following the most current laws, rules, and regulations on your date of service. If laws, rules, and regulations happen to change, we will post information on our website and generally in our e-news to let you know that that information is changed. But in today's event, everything is current according to Medicare laws, rules, and regulations as they stand today. And any responses we give you to questions will be in accordance with laws, rules, and regulations as they are today. Finally, CMS prohibits recording our presentation for any profit-making purposes. I don't know why you'd want to record it because we're already recording it for you. We're going to put it out on our YouTube channel, and it's going to be there for a long time for you to refer anyone to or refer back to in the event you want to listen again. All right, and now on the screen is just some acronyms. Medicare's full of acronyms, so if I happen to use an acronym during the course of this presentation that you're unfamiliar with, you can just refer back to this list. And if it's not on this list and Aline or I happen to use an acronym, you can just place a question in the chat and ask us what that means, and one of us will get right back to you. Okay, now these next couple slides, and I'm not going to read them to you, but they contain definitions from CMS related to dental services. Dental services under Medicare are for diagnoses, treatment, or eliminate oral or dental infections. So they, define a dentist as someone that is a doctor of medicine or dental surgery, again, eligible, legally authorized to practice dentistry in that state, et cetera. But I wanted to make you aware of how they define dental services, a dentist, inextricable linkage, because that's an important part of the coverage. So inextricable linkage is defined here, as well as ancillary services. While we're on this slide and we're looking at inextricable linkage, I'm just going to highlight inextricable linkage means that those services are integral to the clinical outcome or the success of a covered medical procedure. So one can't exist without the other. The services can't be considered separately. They have to be, one has to be done for the outcome of the other to be successful. And in the case of dental services, this is a huge part of the coverage criteria. So again, I wanted to make sure that you had the definitions in front of you. All right. Today, I want you to learn about when to include the KX modifier on claims for dental services that are inextricably linked to medical services. We're going to accomplish this today by reviewing the medical necessity of the services as well as the documentation. And then again, Aline is going to then discuss appending that KX modifier to the claim and what that means to you as a provider. So moving on with coverage. Now, Section 1862A12 of the Social Security Act generally precludes payment under Medicare Part A or B for any expenses that are incurred for services in connection with the care, filling, treatment, removal, or replacement of teeth or structures directly supporting the teeth. Okay? That section of the statute also includes an exception to allow payment to be made for inpatient hospital services in connection with the provision of such dental services if the individual, because of their underlying medical condition and clinical status, or because of the severity of the dental procedure, requires hospitalization in the connection with the provision of such services. So the regulations at the 42 Code of Regulations, and that's section 411.15I, similarly, that excludes payment for dental services except for inpatient hospital services in connection with dental services when hospitalization is required because of the individual's underlying medical condition and clinical status or the severity of the dental procedures. So I know that was a big mouthful on the coverage, but I've summarized it on your slide, but I wanted to give you the references and tell you exactly how it is defined in the federal regulations and the Social Security Act. As we move on, so CMS now makes payment when a physician, including a doctor of medicine or a dental surgery, furnishes dental services within their applicable scope of practice that are integral part of a covered primary procedure or service furnished by another physician treating the primary medical illness. So this is where that inextricable link comes into play. There are instances where dental services are so integral to other medically necessary services, again, that they're inextricably linked to the clinical success of that service. So they cannot be considered outside of each other. And they're not just for, care or filling or treatment or removal or replacement of teeth. So not just your normal dental services. We're going to revisit inextricable linkage again in a few slides, but let's talk about some examples of services that are included, but not limited to. So dental or oral exams performed as part of a comprehensive workup and medically necessary diagnostic and treatment services to eliminate an oral or dental infection prior to or along with the following services: organ transplants, cardiac valve replacements, stem cell transplants, bone marrow transplants, cardiac valve replacements, I think I already said. Let's see, chemotherapy when used in treatment of cancer, CAR T therapy or the chimeric antigen receptor therapy when used in treatment with cancer, and administration of high-dose bone-modifying agents when used in treatment. So all of these things, and expanded on all of these things are necessary. When we're going to be doing an organ transplant, we need to make sure that there are not any other infections, especially of the mouth, that could be harmful to that patient, could make that patient septic, could cause harm to the organ that they are receiving. All right. So other services that are inextricably linked. The reconstruction of a dental ridge performed as a result at the same time as the surgical removal of a tumor. So if there's reconstruction and tumor removal happening, and if there has to be radiation or chemo on top of that as well. Stabilization or immobilization of the teeth in connection with the reduction of a jaw fracture. So think of traumatic events when there is jaw fractures and they have to do some dental splints, wiring of the jaws, bone work in connection with that fracture. Those would be considered for coverage too. And then the extraction of teeth to prepare the jaw for radiation or treatment for neoplastic disease, as well as dental or oral exams performed as part of a comprehensive workup to medically necessary diagnostic and treatment services to eliminate an oral or dental infection prior to or along with medically necessary diagnostic and treatment of dental or oral complications after treatment of head, neck cancers, whether they're using radiation or chemo or surgery or any of the combination of those things. So again, as we looked at these last couple of slides, there are things that have to be done at exams and oral diagnoses and treatments that may need to be done because of the inextricable linkage. As we move on and talk about ancillary services. So ancillary services and supplies that are furnished incident to covered dental services are not excluded, and Medicare payment may be made under Part A or Part B as applicable, whether the service is performed in the inpatient or outpatient setting. And that includes, but is not limited to, like things like the administration of anesthesia, diagnostic x-rays, use of the operating room, and other related procedures. So again, those additional services, if there's an inextricable linkage with the dental service and the medically necessary medical service, and there has to be ancillary services that go along with it, Medicare will also cover those. So what are not covered? We talked a lot about what is covered, but what's not covered? So we already said care, filling, treatment, removal, your normal dental office procedures or structures that directly support the teeth, like the periodontum, and that includes gingivae, dental gingival junctions, periodontal membranes, et cetera. All these things listed on your screen here. And then any dental services that are also related to a non-covered service, those would not be covered as well. So again, think of the services that are normally done in a dental office or in one of the dental specialty offices. Medicare would continue to not pay for those, you know, if it is just normal care of the teeth or the structures, again, that hold the teeth. All right. So some other examples of non-covered dental services. Again, routine dental care, like an extraction of an impacted tooth. Dental services, again, in connection with non-covered services, are not covered either. I got my words before my slide there. So I told you I was going to come back to the inextricable linkage of dental services again. And I just want to revisit this because I want to make sure you have a good understanding of how this is defined and when to think about when Medicare will cover. When we think about inextricable linkage, think about the evidence to support that the standards are or would be to not proceed until a dental or an oral exam is performed to clear that patient of infections, et cetera. Is there literature to support that provision of certain dental services leads to improved healing or improved quality of surgery? Is that evidence clinically meaningful and demonstrates that the dental service results in, a material difference in the terms of clinical outcomes? Finally, is there clinical evidence that is compelling to support that certain dental services would result in clinically significant improvements in quality and safety outcomes? So would there be fewer revisions or fewer readmissions or more rapid healing, quicker discharges, et cetera? All right. So how do we support in our documentation that your services are medically reasonable and necessary and meet the coverage requirements that Medicare has for payment of services? You would do that in your documentation. Excuse me. So the specific components of documentation that help support medical necessity, these things here, so it includes, but it's not limited to, office notes, progress notes, any kind of interdisciplinary communication. Is one physician speaking to the dental physician as well? Are there lab results? History and physical by one and or both providers? Is there procedures or op reports that are important to the planned surgery or planned interventions? What medication have been administered to the patient? So do we have medication administration records? Is there some sort of referral information from one physician to another physician? Have we shown an inextricable linkage? Has someone identified why one service is necessary for the other service to happen? So that's going to be a big one that's going to be, harder for our dentists and our physicians to document. They're not used to having the coverage, so making sure that the documentation supports that is something that we're going to see probably in the office note or a progress note. We're going to see in these interdisciplinary communications, et cetera. Somewhere, if a physician needs to say, hey, it's not safe to proceed with this organ transplant till we've cleared this person's oral cavity of any signs, symptoms of infection, any kind of, to any structures that hold the teeth, et cetera. So again, and if you've issued any ABNs, we would want to see those too. No documentation is off limits. So if I didn't list it on this slide and you document on something different or you call it something different within your office note, then please make sure if you have to submit your documentation for review, that information is also included in the documentation that you submit for review. So, excuse me, at this time, I'm going to pause for just a minute and whoops. All right. And I am going to see, before I turn things over to Aline to talk about the KX modifier if there are any questions that Aline would like me to cover or revisit before we move on. Aline?
Thanks, Mary Sue. We did get a question from Rhonda, so I think this would be a good point in which to pose that. And Rhonda asks, would it be inextricably linked if there was a cyst under a tooth and the tooth has to be removed to remove the cyst?
So Rhonda, it does sound like if the only way the medical procedure of the cyst removal could be done would be to remove the tooth or structures surrounding the tooth, it sounds like that would have an inextricable linkage. Again, it's really going to depend on the documentation and you know, how it is presented, that one could not be done, you know, without the other. So if it is documented well that the tooth had to be removed in order for the cyst removal to be done in the hospital, then you would need to prove that in your documentation. Now, it also needs to be noted, is this a type of procedure that does need hospital services to remove the cyst? Or is this a service that would normally be done or could be done in an outpatient visit of a dental or, you know, periodontal service, office, etc. So the short answer is yes, but the long answer is it really depends on your documentation and supporting that. Yeah, and then you had said, Rhonda, I seemed followed up and said, would say to remove the cyst. Yes, got it. Okay, so at this time, I think that's the only question, and I am going to turn things over to Aline. So Aline, go ahead.
Great, thank you. And thank you, Rhonda, for that good question. If anybody has any questions, make sure to add them in the chat there so that we can address those. We'll give you another chance a little later. My name's Aline, and I'm also on the Provider Outreach and Education team. And so I'm joining with Mary Sue here to kind of give you both sides of the coin. So what I want to do now is define the KX modifier and talk about why it's important. If you've been around Medicare for a little while, you've probably heard of the KX modifier, but you may have heard it used in other indications. And so this modifier here can actually be used in different applications. So the definition, as we've listed here, these are CMS's words, requirements specified in the medical policy have been met. So this modifier can be used with outpatient rehabilitation. It can be used in some of those instances where gender comes into play. It can be used in extra sessions of cardiac rehab, for example. So we wanted to make sure that the definition is here so that you know that it's not specific to one particular item or service, but using CMS's definition there. So a provider, including a dentist, uses this KX modifier, and it's relatively new in the dental realm, and the dental realm itself and expanded coverage by Medicare is evolving as well. So a provider, including a dentist, uses it to attest to the fact that the service or item is, number one, medically necessary, like Mary Sue said, that you have appropriate documentation in your medical record to support or justify the medical necessity, and number three, that coordination of care between the medical and dental practitioners occurred. If any of those items are not met, it may not be appropriate to use the KX modifier. So just like Mary Sue explained, how important the documentation is to prove the medical necessity of the dental services and how they're linked to those medical services. So the dental services and the medical services are linked, and I really liked how Mary Sue used that graphic or that image of the chain to show how really the two can't be separated. The documentation is also key to billing the KX modifier. And then on the next slide, I'd like to spend a few minutes then on focusing on the actual billing aspects of our topic today. So starting July 1st, 2024, providers are encouraged to include the KX modifier on claims with dates of service beginning on or after January 1st, 2024, that meet these criteria. So why the difference in the dates? The regulations went into effect on January 1st, but the systems were not ready yet to accept that. We have some work to do behind the scenes in order to get the dental claim capabilities up and running, since this is something that Medicare is expanding their coverage on. So the systems weren't ready to actually accept that until July 1st. So when you look at the change request, and we have it listed towards the end of the presentation on the resources slide, you'll see the implementation date is July 1st. And on some other things, you'll see the effective date as January 1st. And if you're new to Medicare, that's a little bit of terminology and how all of that works with the regulations. And once a ruling is passed, that it takes some time in order to actually put that into place and to implement those changes. So that's why there's a difference in those dates there. So you can use the KX on dental claims starting July 1st, 2024 for dates of service on or after January 1st, 2024. All right, just wanted to give you a little background information there. So adding the KX modifier is actually going to help expedite determination of your 837D dental or 837P professional claims. So that's what I mean when using the KX tells the system, yes, this claim contains dental services that doesn't usually pay for dental services, but it's okay in this situation because the provider has documentation proving it's all of the things that we went over on the previous slide, that it's medically necessary, the dental services are inextricably linked to the medical services, and the medical and dental practitioners coordinated care for the services. So using that KX modifier actually is you putting the stamp of approval on that saying, this is something Medicare should consider for payment. This doesn't mean that the claims aren't subject to review though. Any claim can be reviewed by WPS or CMS or the recovery audit contractor, any number of review contractors at any time. And so that's why it's so important to have that accurate and complete documentation should you be requested to provide that documentation for a review. So Medicare gives you the guidelines. Mary Sue stressed how important your documentation is and the elements that it should contain. And you just want to make sure that that's rock solid to paint the picture of what's going on with your patient here. I do want to make another note here for those of you that might have Railroad Retirement Board patients. CMS does say at this time, you're going to want to submit those claims to the Railroad Retirement Board using the 837P instead of the 837D because of their capability to process those. So that's just a note there that we wanted to make sure that you were aware of. With all the other regulations that we're spewing out at you today, that's one thing that we're making a side note of there. You know, you might not run into those often, but just so you do, that you're aware of it. We also want to specify that beginning January 1st, 2025, you do have to submit a valid ICD-10 code on the 837D claim forms. The diagnosis code field is required for Medicare fee-for-service to process the claim, but since this is new and we're just getting started, CMS is exercising enforcement discretion for the first few months that the transactions will be received. So right now, claims submitted on the 837D will not reject for that reason alone, for not having a valid ICD-10 code, but that will be coming. After January 1st, 2025, they may be rejected if they don't have a valid diagnosis code. The diagnosis code doesn't have to be the diagnosis for the covered medical service. It can be a diagnosis reflective of the dental treatment. Continuing on with a few more billing reminders here, you can use the GY modifier also to certify that you believe that Medicare shouldn't pay for the service, or if you're submitting a Medicare claim for a denial. So maybe you need to get it paid for by a third-party payer, such as Medicaid. You can also use the GY modifier to submit statutorily excluded services on a non-covered line if you have a claim that has other covered dental services, such as those dental services that are inextricably linked to a claim with other services or procedures that Medicare does cover. And then the last reminder here, don't send the attachments like your x-rays or your periodontal charting with your claim automatically. If WPS or another contractor wants to see those attachments in that documentation, they'll let you know. They'll either put a note on the claim or in the portal, or they'll send you a letter, some other kind of way. So just save yourself some time and some confusion, and don't automatically send those attachments with the claim. Not at this time. Now this slide here, this is the resource slide that I mentioned, and these are the things that were used to create this presentation and where you can go to get more information on the things that we just talked about. If you downloaded a copy of the presentation, you do have the links. And so just kind of going down the line here, the first one contains some instructions on how to complete the dental claim form. The American Dental Association has the responsibility for electronic and paper dental claim content and completion instructions. So you're going to want to follow their instructions. For some of you, this may be new, so it might be of interest to you to see what all that claim contains and how that information is expected to be entered. The next two are CMS change requests. 13190 is educational instructions for the implementation of the Medicare payment for dental services. And then 13649 is specifically related to utilization of the KX modifier for those dental services that are linked to covered medical services. The third one, fourth one, is the Medicare dental coverage page on the CMS website. And I would like to take you out there to show you this, because since this is something that maybe you're not used to Medicare covering for you, and this is a good place to go and learn more about this. So each of these subsections here expand to give you more information and other links for even more information. So a couple things to bring to your attention here. See how it opens there. Now the first one is actually the third subsection, and that's what we're talking about today. Inextricably linked dental services. So again, gives you an overview of what CMS is expecting there and places you can go for more information. If we scroll down to the section that is titled, How Do I Submit a Claim? That's a little bit of what we've been talking about in just the last couple minutes. The 837D, the 837P, some information on the GY modifier that we just mentioned. And then almost all the way down to the bottom of this list, there's a subsection called Additional Resources. So that's even more places where you can go to actually read the regulations, see where it is in the final rule, and that way you know Mary Sue and I didn't make this stuff up. So very good references for you. I hope you take a look at those things. Bookmark those if you want to go back and find even more information. Now, this last resource is a CMS fact sheet, and it's about the CMS 837P and the 1500 claim form. So again, some more information for you there. So that brings us to the end of the presentation. So we're going to go back to the chat here. We're going to take a look and see what's come in for questions that you have related to this topic. Looks like Amy has a question. It says, will claims with dental services billed with KX modifier on the UB hit for medical review? And that's a really good question. And the simple answer is maybe. Part of the CR that we were talking about that's specifically dealing with the KX modifier does say that contractors have the discretion to develop these claims, meaning that if they feel that they need to review them, they can and they will. So they might. I don't know if Mary Sue has more she wants to add to that, but I'll turn it over to her.
No, Aline, I don't really have anything additional to add. Just Aline said it before, any claim that's billed to Medicare has the ability to be subject to hit for medical review. So at this time, we don't have an edit on KX with dental services for medical review, but that doesn't mean that it won't happen in the future. If we decide to do a targeted probe and educate on that service and you are picked as a provider, you will be notified by our medical review department prior to your edit starting, and then they will walk you through the process of what's going to happen. So great, good questions. I am not seeing any other questions in the chat, Aline. So in the interest of time, I will move on with questions, and we'll pause one more time after the next few slides and, give another opportunity for questions. So a few things I wanted to make you guys aware of. On August 7th and August 8th, everyone's welcome to attend a free online National Provider Compliance Conference that's being hosted by CMS. So the National Provider Compliance Conference will bring together Medicare administrative contractors and program integrity experts to provide compliance professionals with the information and tools they need to effectively submit Medicare Part A and Part B, home health, hospice, and even DME claims. So a combination of learning opportunities will be available, including individual presentations, question and answer segments, panel discussions, etc. Again, this one is free and it is virtual. It's a 2-day event, and we have a link on our website, or you can link straight out to it using this link in the slide deck that we provided. The next free opportunity, excuse me, is August 28th and 29th, and this is a go-to event in San Diego, California. So this is Provider Enrollment Conference. So CMS, along with Noridian Health Solutions, is hosting a free go-to event on provider enrollment. At this time, you can take advantage of the opportunity to meet with CMS, meet with MAC contractors on provider enrollment topics, how to maintain compliance with enrollment requirements, what to do if you're new to Medicare, enrolling as a DME, etc. So who wouldn't want to be in San Diego in August? I know I sure would, but if you have the opportunity, go ahead and take advantage of that free educational event. I don't know why I just lost my screen here. Okay, but on behalf of Aline and myself and all of Medical Review, I want to thank you for attending today's event. And this concludes our presentation, and you can now disconnect.